back, and as was mentioned, a part of our conversation for today would be with the Executive Director of CARPHA, Dr. James Hospedales. Good morning. Thank you for joining us. And still with me, I have at this time Andy.
Yes, good morning once again.
Now, Dr. Hospedales, definitely the role of CARPHA has been one when it comes to different health emergencies has been highlighted. Let's just get an overview as to the work that you do.
Well, the work that we do at the Caribbean Public Health Agency, CARPHA, is to respond to the public health threats and priorities in the region. We're an instrument of cooperation in health in the Caribbean, and I think a very successful one over the years, although we're under-resourced. And we try to respond to a range of problems that our region has. We have major problems with the NCDs, diabetes, heart, overweight, smoking, that whole package that is causing a significant damage to the economy and to people. We still have infectious disease threats, and we've seen just in the last 2 or 3 years chikungunya epidemic, the threat of Ebola, and now we're facing the Zika virus. We have in many of our countries also what can also be described as epidemics of violence and injuries. If you look back over the last 10 to 15 years, you can clearly see some countries have had major increases. So that the Caribbean overall has a homicide rate of about 30 per 100,000 compared to the US, which is 5, Canada, which is about 1.5. So those we're responding to a range of public health challenges, and we monitor. We have a range of systems for monitoring health, what people die from, what they're sick from, what risks there are, and then to help governments formulate policy, advise on setting up programs. Our laboratories, the major reference and referral laboratories for infectious diseases in the Caribbean, and the airlines, Caribbean Airlines, LIAT are among those that help with the transfer of specimens. So that's public information, and keeping both policymakers and the public informed is another important part of our role. Coordination of a regional response to a public health emergency, such as is happening now with Zika. Those would be some of the major features of CARPHA's work.
Now, I want to start off before we move into Zika, which we know is really the primary concern of most people. But looking at the issue of NCDs and the cost that it has been having in terms of public health care across the region, there has been a major effort to be able to get multiple agencies on board, a lot of the cancer organizations, diabetes, and just to have the public aware of the risks that are associated and the cost that it's going to play on them and also on the larger economies. In terms of regional strategies, where are we with that?
That's a good question. The next week in Port of Spain, there's going to be a sitting down and a reflection on the last 7 or 8 years of implementation of the strategies determined by the heads of government in 2007 at what was a historic summit where heads of government for the first time looked at this problem of NCDs. And they looked at it, as you said, because of the huge human cost, the economic cost, and because what needs to be done is in large part outside of the health sector. So if you need to change what people are eating, if you need to provide sidewalks or biking lanes, if you need to tax tobacco and alcohol, etc., it is outside the purview of the Minister of Health. And so that's why it went there. So over the last 7 years, we've been monitoring every year on a scorecard 26 key indicators of commitment, of tobacco control, diet, physical activity, surveillance, and how people are being treated in the health services. And we've made progress in some areas, and in some areas we've not made progress, or hardly at all. And so next week in Port of Spain, there'll be a reflection on this and a refining of the strategies going forward.
And Doctor, that comes out of the report of the task force that was led by Sir George Allen on the
Yes,
subject.
that in a way was the beginning. There was a task force about 12 years ago called the Commission on Health and Development. I was one of the commissioners. It was chaired by Sir George Allen, who was the Chancellor of UWI. And that determined 3 super priorities in health, one of which was NCDs. And that led to the Port of Spain Summit, which was hosted by Prime Minister Manning, chaired by Prime Minister Arthur, with the lead head for health, Denzil Douglas, speaking to the issue, and the heads committing the Port of Spain Declaration, which has 15 points and 20-some commitments. And the legacy of that was then through the Summit of the Americas, through Commonwealth heads, to the UN, to New York. It was the first time that such small countries had gotten a subject on the UN agenda, a global agenda. And we need to, because we are small and vulnerable, so we have to influence the rest of the world.
Yeah, and like with the rest of the issues that CARICOM deals with on a broader scale, you say that, you know, of your 26 points for action, in some cases there's been progress, in other cases none. You know, if you measure it out, you would say that there's been more progress than less, or there's
Good question. I think there's been more progress than less. But because of the nature of this problem, people don't feel pain from hypertension until they get a stroke or a heart attack. There is not the sense of urgency that we have, say, for Zika. And this compelling attention to the whole thing. And yet, the cost, when you think 10-15% of people have diabetes, a third, 40% have hypertension. The majority of adults in most of our countries are now overweight or obese. And children, that is the emerging frontier, where a fifth to a third of children are overweight or obese. That's not good for our future development. And a child who's obese has a devil of a time shedding that weight later on. They're destined almost to be an adult who's obese. With it, you have 50% higher lifetime health costs. You're going to have problems with employment, problems with stigma and discrimination. So for all these reasons, the one that we haven't, the area that has not moved, that we're extremely concerned about, is the food environment, which is driving the obesity epidemic, which drives diabetes, drives cancer, drives hypertension. And so with the Council of Trade and Economic Development, about 18 months ago, we made a presentation on the need for the economic sectors to work with us. And then just in November last year, we presented a 6-point policy package for addressing the childhood obesity from the economic sector point of view. And if I tell you what those 6 points are, it's not very much for the health minister to do. It's mandatory nutritional labeling. Most of our countries don't require that food produced for national consumption be labeled, so you empower consumers. It's regulating the school feeding environment to reduce some of the junk that's available in the schools. It's reducing advertising of junk food to children, so that's Attorney General's work. It's bringing the food manufacturers to the table to reformulate products to reduce salt, fat, sugar, and eliminate trans fatty acids.
Things aren't simple, easy to do.
They are not easy to do. That's a 5 to 10 year agenda.
And we've seen cases in the United States, for example, where bans on excess sugar and particular fats have become very controversial.
Yeah. Well, the industry pushes back.
Yes. In terms of being able to achieve that within the Caribbean, do you think it's something that would happen within the next 5 to 10 years?
Well, funny you should ask that, because in the United States, the issue of soda taxes was defeated in over 20 jurisdictions. And the leadership is coming from the South, in Ecuador, in Mexico, in Barbados. They put on soda taxes. Coca-Cola flew a big wig down to Barbados to say, please don't do this. And they said, this is a health issue. And they're sticking with it. UWI and CARPHA are now doing an evaluation of that soda tax. So I think we may see some shift as we face this huge epidemic. I think that's going to be coming.
It's too early to ask about, say, what's the impact of the steps that the government of Trinidad and Tobago took in terms of, I don't want to use the term demonizing, but restricting people's likeness for tobacco and cigarettes.
Well, the Trinidad and Tobago government did have a good legislative package on tobacco. And we need to continue. The region as a whole doesn't have a huge problem, but it's still a significant one, especially among men, especially among single young men. Rates of tobacco smoking are high, so we have to keep on with that. Trinidad and Tobago overall has seen some positive benefits from its strong programs over the last 10 years. I was involved in an evaluation last year that showed significant benefits from the CDAP program, which makes available medications free for people with hypertension, diabetes. Perhaps over 5,000 deaths were avoided over a 5-year period. And the effect was accelerating as other measures came on stream, like tobacco and healthy diets and so on.
Now,
I know you want to get to Zika.
Yes. I don't want to lose the opportunity to get to Zika, although I think the issue of NCD is of utmost importance. Now, it obviously has been a lot by the media, in terms of international media, a major concern for people. At this time, there are 5 CARICOM member states that have confirmed cases of Zika. Let's talk about the number of tests that are taking place at the labs and the rate of confirmation.
Thanks. Well, since last year, when this became a problem in South America, we stepped up our testing capabilities and alerted all the countries. So we're getting in from all the countries as they suspect cases, specimens for testing. The rate of confirmation, and we've also enhanced our testing. So, for example, Zika presents with fever, rash, muscle aches and pains, which could be measles, it could be dengue.
Or chicken.
And the surveillance systems that we have for that, we have enhanced surveillance for Zika. That if they're negative for dengue, if they're negative for chikungunya, then we would look at to see if Zika is creeping in. So that's one of the first things to do to characterize the epidemic. Where is transmission taking place? Who are the people most affected? And so the labs play a key role at the beginning of an epidemic.
And the number of confirmed cases we have so far?
We're not attempting to track cases in this epidemic because 3/4 of people who are infected have no symptoms. So we're focused on our testing on detecting newly infected areas, helping to investigate outbreaks and complicated cases. The whole development with Zika virus apparently causing microcephaly in babies born to pregnant mothers who get infected while they're pregnant. That's new, and we're currently reevaluating what sort of testing protocols and building of capacity in countries we'll need to do in the next year or two.
I want to ask you about that, Doctor, because we would have. I'm not sure if you would read the piece in the Express by a man who was taking issue with it, saying, essentially that the issue was being blown out of proportion. The number of cases in Brazil where women were found to have had it, and that led to microencephaly, as opposed to people who tested positive for the virus. He's writing against a theory of conspiracy, if you like.
Well, whenever a new disease emerges and things are unclear about what is really causing it, you tend to find a lot of theories, conspiracy theories. So people will claim it's the larvicide, it's a genetically modified insect, it was a vaccine that was given at the same time. And all of those have to be looked at, and there are ways to assess whether this has substance or not. So take the issue of the larvicide. But it doesn't make sense because this chemical is used right across the world, has been used for many years. So if there had been this sort of association, it would more than likely have been picked up before. My wife's a veterinarian. It's used at home for flea control in our own house. So I think that's unlikely that's...
So the link to larvicide has not been established. It's just one of the conspiracy theories.
It's one of the theories.
Yes. But the link to Zika is still not confirmed as yet.
There are a number of things, steps you go through, again with a new disease, before you definitely say this is the cause. And the evidence is getting stronger and stronger and stronger that this is what it is.
For educational purposes, the link to microcephaly is when the pregnant woman contracts Zika at what point in her pregnancy?
The risk period seems to be the first 3 to 6 months, especially the first trimester, which is how other viruses that cause those problems also behave, like take rubella, German measles. If you get that in the first 3 to 6 months of pregnancy, you have a higher chance of getting a problem with the baby. So this is consistent. So it's the first 3 to 6 months.
So what is going to come out of this meeting, Doctor, on the question of Zika and for your leadership role in taking this forward?
We brought this to the level of heads, and the Secretary General agreed because it is a health issue, it's an economic issue, affecting tourism, it's an environmental issue, and so it needed to come to this level. We need to have more investment in public health in the region, both at national and at regional level. So I think heads were seized of that, and I haven't seen the final communique, but it speaks to them issuing a call to the whole population for a multi-sectoral response, getting the private sector on board, strengthening coordination. Strong public information, consistent public information. So those are some of the key points that are in there that they're coming out with.
And you were saying before we went on the air that one part of the greatest threat about it is its potential impact on tourism in the region.
Yes, the CTO did an estimate that if there were a 2% decline in tourism, it translates to 200 to 400 million loss in revenues. And if it's sustained, we may be talking about 500 million to $1 billion in loss if it's sustained for 2 or 3 years, for example. One of the things the heads also decided on was a mosquito action week. the week of the, I think it's the 12th of May. Every year that we would use that as a way for rallying people and businesses and all government to pay attention to this problem, to eliminate the Aedes aegypti mosquito, which is the same mosquito that transmits
dengue and
Zika, dengue and chikungunya. A mosquito we almost have a love affair with. We feed it, we provide it a place to breed, and we provide it shelter. And that domestication of that species in much of the tropical world is a particular challenge to us. If you then find a virus that comes from a monkey but is spread through this way, and you bring it into our population, and the virus is so, and the mosquito is so closely living with us. So we have to change our attitude to that mosquito.
And in terms of public health in general, what we have seen in the past couple of years with emerging diseases in this region like chikungunya and Zika is how difficult it is to be able to respond adequately. Chikungunya, for example, entered the region and spread so rapidly. Zika is attempting to do the same. In terms of your role at CARPHA in preparing for what may come next year, what do you do to be able to ensure that the state of preparedness is there?
Yeah. Well, that's a very good question as well. Arising from the threat of Ebola and chikungunya, heads about 14 months ago had a special session, their 17th ever special session on public health threats, chikungunya and Zika, and they issued a 10-point plan, which we've broadly been following towards that to build up the preparedness. So there are regular virtual meetings of all the epidemiologists, lab, chief medical officers, and tracking abroad, tying into we have a Caribbean travel network, which on a regular basis we speak to CDC, the Canadians, Public Health England, Holland and France, our major markets, to try to share information about travel-related illnesses and reduce some of the tone of their travel advisories that they may be putting out.
Let me ask you, Doctor, you know, as a people, we tend to, and probably in some of the countries in the region more than others, we tend to beat up ourselves about you know, our state of play regarding public health and the delivery of public health services to citizens. What can you tell us about how CARPHA and the region is rated in that respect by other international agencies having to do with public health?
Depends on the indicators you look at. If you look at life expectancy and a number of other indicators, and the Caribbean has made a lot of progress in general and relatively healthy. Over the years, the governments have invested in primary health care, and that has made a big difference to us. What we're now facing is different sets of challenges as the population grows older, the chronic diseases, and all these injuries that we face. So you have different challenges. It's not as if you have to follow up people for life. You have to pay more attention to adherence to treatment. Governments in Trinidad and Jamaica have made treatment available for free for hypertension, diabetes, cholesterol. People only access it about half the time. So you have a ways to go to increase the uptake of some of the policies that governments already have.
Yeah. I was interested to hear you include the outcomes of crime and violence as one of the things that you have under surveillance. How does that get into a public health agency?
The public health agency monitors the health situation, and one of the ways you do that is what are people dying from, and how is that changing over time, and how does it differ between different countries? Because if one country is high in something and low in another, it makes you go, well, why is it low here? And what are they doing that? So as a result of that, we track injuries and violence among all the things that people die from. And you can see some of our countries, Guyana, Suriname, are in the top 10 of the world for suicide rates. Some of our countries have very high and increasing levels of traffic fatalities. Belize has a high traffic fatality problem, so does Guyana. And these things there are public health solutions. You can study what the problem is, where does it take place, to whom is it happening, what are the risks, and then make interventions. Seatbelt laws. We believe, for example, that the region needs comprehensive policies to reduce the harmful use of alcohol as a public health priority. I'm talking about stop drinking, but reducing the harmful use of alcohol. That's another thing that's causing us a lot of problems. It drives non-communicable diseases. It drives all forms of injuries and violence. Domestic violence, traffic fatalities, fella killing another one because he vexed because he drunk. And it also drives mental health problems. and loss of productivity in the workplace, absenteeism in the workplace, so alcohol as a region, we have a ambivalent attitude. From a public health point of view, it's clear we have to strengthen the programs to reduce the harmful use of alcohol.
Just because we both live and work in Trinidad and Tobago, what are we hiding?
No bias at all.
So to conclude the point about why we track injuries and violence is part of what we track, and WHO 2 years ago published Preventing Violence, What Works, the evidence of what works, and there are 8 or 9 very clear things that can be done at national level, and alcohol control is one. Gender sensitization is another. Training kids in conflict management. In Jamaica, I was there a couple of weeks ago, saw a very interesting program where they're using a behavioral vaccine to get teachers not to beat kids in the classroom, because it's against the law.
Behavioral vaccine.
A behavioral vaccine, by showing what you can, instead of saying don't beat the children, don't beat the children. Say here's what you do when a child behaves in this way. And they very quickly take that up. And the rates of beating decline rapidly. So those kinds of things we need.
And this is a part of the challenge when it comes to public health. Some argue that perhaps you need to be a bit more punitive when you're talking about seatbelt laws, whether or not you'll get a vaccine, etc. And a lot of the work that comes out of WHO pushes for the communication aspect, talking about how do you impact behavioral change down to the very smallest message that is communicated. How are we doing in this region in terms of how we communicate the most important public health messages to our people?
That's a good question, and I think we can do a lot better. One, to be consistent across the region. Two, to leverage a lot of different channels, including the new media. We've set up a regional health communications network last year, so every country has a link, and we link up to all the GISs. I think we can do better, and we perhaps need to be thinking about a sustained regional public health communication campaign using all the channels, speaking to different audiences. And Andy, you're smiling. You'd be happy to hear something like that.
Yes. I just I'm interested about the behavioral vaccine. That would be for the teachers or the students?
It was for the teachers. But you ask a good question, because maybe there are other things that can be done. We'll go to domestic violence. It's wrong. You shouldn't beat the wife. Shouldn't. But then you discover a lot of women have a belief system that there are certain circumstances under which it is okay for the husband or the man to beat them.
If you don't beat me, you don't love me. And that's still, obtains.
If that is prevalent, then you have a hard time. And then you tell her, don't do that, but you're not showing, well, how do you cope when you're vexed, when you're this way? So men need help. Men need help to grow up, if you will, and to how to manage. So that's why I'm excited by that particular behavioral vaccine that I saw for reducing violence in Jamaican schools.
That is something very interesting to look at. Well, we have to close off this segment at this time, but I do want to give you the opportunity to speak to the viewers, to talk about just what the most important things are to consider when it comes to Zika.
Zika virus. Yes. Well, the most important things to consider with Zika virus is to realize that this is spread by the same mosquito that spreads dengue and chikungunya, and to stop mosquitoes breeding in and around the house and stop them biting, particularly if it's a pregnant woman, a person who has chronic health problems, then you really want to avoid being bitten by mosquitoes. And stay informed, stay tuned to how this disease moves through our region.
All right. Well, thank you so much for joining us.
Okay. Thank you very much.
We're going to go ahead and take a break, and we will be back in a few. Stay tuned.